Just so that you all know, I have Marshall Lemoyne on with us. Marshall is actually one of the founders. He's in pretty much all the orthopedic videos that you see. And Marshall is a clinical specialist at Kaiser. He kind of run or helps to organize a lot of the orthopedic residency and fellowship, or he mentors in there as well as helping to choose the new residents and fellows and teaches some of their courses. And we also have Dr. James Sims. Now, the cool thing that I'll show you later in the presentation is a really, really cool alternative for students to learn the laws and regs. We are testing this new model. I think will be way better for student learning. So I'm excited to share that with you. And James, you feel free to speak in as well when we get to that section.
Okay.
I wanted to make sure that this was relevant to you. My goal here is to actually share with you a little bit about what we have in PhysioU, a little glimpse of how we're using it, so it may stimulate some ideas for you, and also to give you a snapshot into what we are building into the future. So I'm going to go ahead and get started. Just so you know, some colleagues wrote in and said they wouldn't be able to attend, and so I'm recording this session. We will send it out to you as well as any colleagues who couldn't make it. So just so you know, and feel free to chat any questions or comments you might have. Marshall or James will read it out when they find an appropriate time, and then we can just. I really enjoy the discussion and hearing your ideas and challenges so that we can actually build more things to improve education. So just as a quick introduction, I've been at Azusa Pacific University for the last 15 years. Man, I feel like it's even more now. The time seems to fly. I'm an associate professor. I chair the Institutional Review Board. I have the privilege of also learning from a lot of really brilliant teachers of teachers. So I serve as a teaching and learning fellow here at the university and teach for the Kaiser Orthopaedic Residency and Spine Fellowship, as well as the USC, University of Southern California Spine Fellowship. And the last 5-6 years, I have really been exploring and dreaming of creating resources that will make the instructor's life easier and make learning deeper and more engaging for the students. So this is really a glimpse of what we've been dreaming about doing in the flesh. So PhysioU, and why did we do it? So a lot of emerging things came up over my years in entry level. One is the cost of graduate education is just unbearable. And I see that over and over again. Not only the material cost for what we teach, but the textbooks, the resources. And I really began to reflect on, do these resources serve the purpose that I need to make sure that the students are strong clinicians when they get out into the clinical world? I also realized, having written my own little pocket orthopedics, that many of these resources quickly become shelved and out of date. And for that matter, some of the data we collected from our students demonstrated that the students were not reading this and were not purchasing these resources either. So it really left me in a quandary. How am I going to deliver information and how am I going to help them to learn best? So this was another one of those concerns and things that drove the development of the apps. Also, I realized that many of the resources that we give our students, whether they are notes or books, that they weren't really mobile and that we only really released it to them when they came to that one class. My dream was that they would start with a slew of useful resources and that they would be able to use it or access it throughout the curriculum all the way out into the clinic, so that there was this continuity of how they learned and how they re-accessed information. There was also a lack of high-quality video-driven resources to assist in motor learning. PT is an easy, low-hanging fruit profession where so much of what we teach is really skill-based. And so to have to read about it and read 7 steps and look at 7 black and white photos was really, for me, not a great way of teaching these high-level skill sets. And then lastly, some of the new things that we're building is ways to create context for learning. I'll talk a little bit more about that later, but imagine in our traditional model, we often release little bits of information 1 week at a time. And eventually that snowballs into this massive avalanche of material that we hope they can pull together at the end. Imagine, and this is the way I use the apps in the classroom now, that you could create roadmaps for how an examination and treatment and intervention and exercise, how all of those are connected from the front end. And then you could teach the techniques to fill in the details of that master map. And that has been a very powerful experience as I watch the students integrate the content better. So PhysioU used to be a bunch of apps floating around in the App Store. We decided to consolidate all of it into one web app in which there's one place for you to get all your updates and all your new apps. So PhysioU, as many of you have tried or are already using, is a web-based app that you can access on any of your mobile devices. So the students will carry this one resource in their pocket and be able to utilize it throughout the curriculum. The top 3 objectives for today is to share some common teaching and learning challenges that many faculty have written in and shared with us. Then to talk about building bridges with PhysioU, so an evolving case study. So some of the data from some of the information we collected in our program that we presented at ELC in 2018. And then mini short app demos so that I can kind of customize which apps you might want to see and give you ideas of how we're going to use it. So I'm going to move into the common issues from some of the DPT programs. And many of these issues I've heard over and over again related to PTA programs as well. So the students really want to see a lot of the skills. They would like to be able to pre-expose themselves to it. So they're searching all over the internet and watching videos of varying quality, of which occasionally creates issues. So they don't really want to look at pictures. They don't want to read the textbooks, the text in the lab books. And so we thought, why don't we try to film the bulk of the techniques that they're going to learn in PT school and make that accessible. So that's one of the reasons, is to solve this problem and to make it easier so that we didn't each have to film all of these videos and then reproduce that wheel over and over again. Many faculty have talked about there's just so many resources all over the place. I would like to just consolidate. I'm happy with one way of doing MMT. I don't need 4 MMT textbooks telling me different methods and having to actually, resolve that conflict. And so again, I think creating a one-stop shop that would make it easier for the faculty to get the job done saves us time that we can put into creating an active and engaging learning environment. The amount of material to cover, there's too much material to cover. In the orthopedic apps, you can imagine it could have been massive. It is already massive. But we have carefully, in talks with people who have written the guidelines, in talks with many faculty, we have continued to try to trim the technique list to what we consider probably the basic bare bones, so that there isn't 7 techniques for every joint mobilization that you want to do. They can learn a lot of these variations later. And the students, we really want to help them assimilate a large amount of this material and know how to apply it. That's why instead of just creating libraries and libraries of techniques, we have spent a lot of time building logic into the apps so that students can see how things are connected. A few other common issues: keeping resources current and evidence-based. By having PhysioU as potentially as part of your curriculum, all of this is constantly being updated. So Marshall and I go through the Clinical Practice Guidelines every new revision, and we make new additions or remove things from the apps. So unlike the traditional textbook model, we are continuously giving you the latest edition. There is no such thing as a 3rd edition or a 4th edition. There's only the latest evidence edition. We also have a very vested interest in delivering the clinical practice guidelines into the curriculum as a foundational component, because everyone can agree that besides everybody's knack or training expertise, whatever school of thought you come from, that the clinical practice guidelines becomes this baseline everyone can agree is the minimum way that we should look at low back pain or neck pain, for example. And so we, as partners, we are technology partners with JOSPT, and we have a very big interest in trying to get these clinical practice guidelines and the language of the ICF into the classroom to make it simple. Meeting multiple learning styles, or the needs of multiple learning styles, and reducing the need for you to search on YouTube. Imagine being able to pull up the videos. The students can watch lab techniques before they come to class, which is how we do it. And then in class, you can show some of these techniques. You can demonstrate it on your student, and they take their iPads with them or their computers with them, and they practice. So your window of exposure is way bigger than here's lab, here's the first time you're going to see the technique, good luck after that. So I think that in our data has shown that students basically say that really reduces my anxiety in lab. And then updating lab handouts with pictures and videos. A lot of the techniques now that we teach in cardiopulm, in neuro, in ortho, all of these are, for the most part, in the app. The other thing I would say here is we are always open. We're always open for discussion. So as faculty either see things that are like a little bit different from how they would do it, or there are certain techniques that they're like, man, that should totally be in the apps. We're filming, so we can film anything and add anything in at any time. Our team usually vets any request to determine, is this in the best interest of the larger group? I think that is always a consideration when you're trying to build something to serve many people. So let me just take a moment there and open it up. I'd love to hear from any of the other faculty. What are some of the common issues that you've been facing that PhysioU could potentially help with, or in general? And make sure you unmute yourself if you're accidentally muted there. Any thoughts, Steve? Any challenges?
No, I think you from, just getting back into academia after being out for a long time, all these challenges you describe are certainly there for me personally. And to have that resource there, really, it's awesome. I mean, I think that'd be, you're updating all the information, and for certainly, the challenge is integrating those clinical practice guidelines and the language. I think that's going to be very helpful.
Yeah, absolutely. Anybody else?
Mike, this is James. If I can ask a question, maybe help get questions. That is, how many of you folks are already using it, and to what degree? Steve, like you're doing the ortho stuff, but do your cardiopulmonary folks use the cardiopulmonary portion of it and stuff? And a tangent to that question then would be, how much of it's embedded in the whole curriculum? Because as Dr. Wong said, it's just teaching them how to learn, it's not just a repository of data and facts, it's clinical guidelines, stuff like that. It's helpful for that, but how to craft and shape the way the students think. And if that's
right.
being done consistently through the curriculum,
yep.
that this app can help with.
Yep. Anybody else?
I would say, Michael, I don't know, because I haven't been on faculty long enough to meet some other individuals, but I see this being there's a big emphasis on different learning styles and educating students on how to study. And this is to me, if that is being weaved in the program the way I've witnessed it, I wouldn't see why this would not be an ideal tool for that to be emphasized and to create. It's just a matter of, to me, I appreciate the power this tool has. It's just a matter of integrating it into the different learning styles and into the curriculum and particularly in a condensed curriculum that is a reversed or flipped classroom curriculum.
Yeah.
This tool could be even more valuable, because the students need to get off on their own and play with this.
Yeah.
They certainly need some basic understanding about how to integrate it, but I see it as being a powerful tool to enable them to work in study groups, to work in small groups, large groups. But again, I can't sit here and say from experience. I can say from what I can see conceptually as being a very powerful tool.
Yes, great. Yeah.
Daniel typed in a comment, Mike. If you look at the group chat, or I can read it to you.
Yeah, go for it.
Daniel, you're right. It seems that the content was strong in ortho. And 2 weeks ago, when I looked at the neuro and cardiac section, the cardiac section was in early stages. Looking forward to better content in those areas, or that area. So.
Yeah, Daniel, I would mention that the Cardiopulm app is fairly well fleshed out, meaning we built it to augment my chair's class, where she said, none of our students come in prepared with experience related to cardiopulm. So I would love to have a way to show them these are the most common conditions. This is the type of story that patients will tell you. And these are the types of examination and intervention strategies related to that clinical pattern, right? I mean, our orthopedic apps are built around the idea of clinical pattern recognition. And so technically, all the techniques that are being taught in Cardiopulm class are all in the Cardiopulm app. And I can show everybody a little glimpse of that. There are also case studies that various programs are using. A colleague, Tony Iwakawa in Toro College, they use the Cardiopulm cases because we purposely built in the potential for someone having leg pain with walking to have potentially some type of peripheral vascular problem, or they're old enough to also have a spinal stenosis potential problem. And so they're using these case studies as ways to talk about multiple systems. And so I hope that can be a further conversation for things that you might be looking for. But for our Cardiopulm class, every lab technique, and actually let me just take a moment here to go to that just for a second here. So if you go to PhysioU.com, all of you should have the apps, and if not, we'll get access for you. In the Cardiopulm app, the students are in a flipped classroom, so they watch their pathophys lectures online. In class, what will happen is they will play through these different categories to develop the pattern recognition. So they have cardiac, these are the 5 main patterns that the students are going to learn to manage, identify, and treat. So from there, in class or online, if you're in kind of your sync sessions, they will watch a video.
Well, I have been fairly active all my life, but lately I have been so tired and so weak. And what frightens me most is my legs and my feet have been swelling. And I'm having a little trouble breathing too. I need 3 pillows to sleep at night. I have had high blood pressure for a long time, and my doctor has given me medication for that, but sometimes I forget to take it, in fact, often.
So the instructor will say, hey, based on your pathophys lecture, what do you think? Why does she complain of the different signs and symptoms, or the different symptoms? What is consistent with the pathophysiology? So they have this discussion, and they're building this pattern, this picture of a patient. Then there's a discussion briefly about the common outcome measures. These are all links. So the outcome measures are available online. They're all linked here. Some functional performance, some geriatric considerations. We've added this in also to help with the lifespan concept. And then an observation of a cardiopulm specialist doing a subjective that the students can mimic. And here is the physical exam, a little clinical reasoning video, a chart review, and then the objective test that they're going to learn in lab, right? So in this particular case, peripheral edema assessment is very specific to this particular condition. And the interventions are also all matched. So your typical interventions. So I think this is where I can actually overlay this idea that the students being able to see all these pieces all linked together makes it that much easier for them to ingest or take in the individual techniques that they're going to learn in lab, because they have this master framework that we've talked about ahead of time. So I do that every week in ortho. I play through 2 or 3 main patterns: the frozen shoulder, the unstable shoulder, and the shoulder impingement. I play through them so that the students know what is behind the closed doors. When they walk into the PhysioU house, where it's massive and there's a ton of apps in there, I do it every week to unlock the value of this tool, so they never feel scared walking in. They know what they're going to find. They know how things are linked together. And it also allows me to kind of share my clinical expertise. And that is actually when the students begin to really use the apps on their own time. Prior to that, without the instructor actually giving them a small walking tour and building context for them, I'm not sure they can actually handle all the information in there. But once you do it once, they learn to do it on their own. Any other comments or questions?
Mike, there's a couple on the chat. You want to look at it? Or you want me to?
Oh, go for it.
Well, you can read them, but I already answered one of them, that they asked, are any textbooks being replaced by the app? And I know at the educational leadership meeting and at the last two CSMs, I've had about 3 to 4, maybe 5 to 6 instructors say that, yeah, they've been able to reduce the number of textbooks that they require their students because of the information in the app.
For sure. Yeah.
And so
I would say on the front end, I'm sunsetting my own textbook because I don't need special textbooks anymore. Because the special tests that we're going to teach, you can watch videos and look at all of the research data, and we can continue to update and reduce. So even my own textbook that has a bunch of special tests in there, I don't find that it serves that purpose anymore. We have instructors who are going to eventually eliminate their range of motion MMT text, because there's not much that you can't learn from just watching the video that you would have to read through in the textbook. So I think some of those types of textbooks, maybe even some of the therapeutic exercise textbooks, you have to decide, do they do the job well? When the students get out into the clinic, do they still not know how to apply clinical exercises, therapeutic exercises? I mean, we get that same feedback. I think that's common feedback across the board, is one, the students don't know how to don't know when not to use special tests. They're using special tests on everything. So I think sometimes there's an overemphasis of the special tests. And when it comes to therapeutic exercises, there's no context for them to know when to use things. And so we begin to hear about it over and over again when they get to the clinic. And so I think as a faculty member, each of us have to look at our content and decide what is the optimal tool to teach this content, and what are the tools that no longer do the job, and decide how we are going to spend the students' dollars and spend their time, actually.
The other question is pushback from any textbook publishers, Dr. Wong?
Yeah, actually, surprisingly, there has been, at this past CSM, some very big publishers came by and said, hey, it's amazing what you are doing. We are looking forward to collaborating. And if not, we can agree to be competitors. Honestly, I've never thought of this as being a competitor. I've thought of this as being an augmentation to the classroom. So the faculty I still use certain textbooks in my classroom because I believe the textbooks bring a certain level of depth that my apps were not designed to do. I don't want to go so deep in that I cannot build connections to all that content. My apps were designed primarily to help with motor learning and develop on a large scale clinical reasoning, these cognitive maps that can help students build and kind of link content across the curriculum and build bridges for their clinical reasoning. So certainly, I believe that the textbook industry may consider what we're doing as potentially a threat. I would just say that I have done this purely out of enhancing the joy of teaching for myself, and enhancing deep learning for my students. There's been no other motive besides to improve teaching and learning. So let me move on here. So just to give you a quick glimpse, I think it's always useful to see what is in the minds of the students as we're beginning to implement these apps in our classroom. So this is something we presented at ELC. We're talking about building bridges between didactic and clinical education using guideline-based mobile apps. So we did a literature review, and there's a decent amount of stuff out there about integrating technology into PT curriculum. And I thought this really made, this statement is very important. The implementation of technology can enhance learning. I don't think it will replace textbooks ever, and that's not our intention. But the technology can make the classroom a more active and student-centered environment. So meeting students at their level of comfort with technology can be the key to the whole puzzle. I think each of us as faculty and also our students, there is a wide spectrum of people of varying levels of technology savviness. And I think for each of us, we have to determine what is the best way to use this in my class, and I can use it a little bit at a time. It doesn't have to be really that daunting. Again, I'll share a little bit of how we're using it in our program, and we will have a series where we're bringing on different faculty who are using it in their classroom for different classes in future webinars. But I really think when you are considering how do I enhance my classroom with these apps, it doesn't have to be like 2 feet, you're jumping in the pool. You could just dip your toe in, show students videos from the apps, integrate that into your lab sheet, and call it the day. That's the first version of your kind of technological revolution. We asked the students in the course of a DPT program, out of the required or recommended textbooks, what percentage have you purchased? What we found was that 80% of the students were buying less than 40% of the textbooks, required or recommended. So either we are not utilizing it well enough that they find value in spending their money and spending their time in those books, or they have just chosen that that is not the way that they want to learn. So whatever the case, it was kind of a shock to us when we talked about it at faculty meeting. We require certain textbooks, we recommend a bunch of textbooks, but in the end, are the students buying them? The bulk of them are not buying them. We also asked them a bunch of questions. The utilization of the apps helped in what? And so I'm just breaking down the things where we had pretty high percentages. Mastery and confidence. I feel well prepared for my techniques. One of the reasons why I think that happens is because they are exposed multiple times to those techniques before class, during class, after class, and that same app is in their pocket when they're in the clinic. It's graded exposure, right? So I think that multiple exposure makes a very big difference. And it has to be intentional from the faculty's perspective. They have to have marching orders. So the students need to know, before you come to lab, I want you to look at the shoulder, MMT, and range of motion videos so that we can go through it together in class. They also talk about feeling prepared for clinic. So imagine a class where a lot of, I'm talking about MSK in particular here, orthopedics, where the design of the class is not just to deliver techniques, but in fact, to prepare them to treat the most common conditions based on the guidelines. Our students will know how to treat all the guideline-based neck pain, back pain, shoulder pain, knee pain, all of those. They are prepared not only to treat it, to examine it, but we play out so many scenarios. We've played out the apps and shown them the cognitive maps of how this all comes together so many times that the output of the class is not just a student encumbered, right, heavily loaded with all of these techniques and tests and not really having the context on how to use it. But in fact, every step along the way, we are unpacking that content. We're putting it to use. We're playing it out in the apps. So by the by the time you are at final exams of your last semester of ortho, what you have is a fully fledged, ready for clinic clinician. That's how I imagine students should be going out into their clinical settings. I'm hoping that the learning that they're going to do in the clinic is much higher level than I think what most students experience. Because I think we prepare them well for it. It's a top priority in our orthopedic class. They talk about synthesis and learning. So connecting the dots, making prescriptions, making prognosis, trying to create, right, instead of regurgitate. So I think that's a good sign. And development of clinical reasoning. They also talked about reduced anxiety in the lab, and I think it's because they know the resource is available to them. The instructor invites them to use the resource early, which means when they learn things in class, it's not the first exposure. They know what questions to ask. They're familiar with the way the technique is done. I think that's a big part of learning faster and learning deeper. They feel it's more efficient and has helped them develop as a student clinician. Any comments about that? Okay, good. So let me move on then. One of the things that drove me to build these apps and then eventually to build apps for every major content area is because inevitably our content is delivered in semesters and silos, which means that every new class is a desperate sprint for survival. There's going to be new resources. You're never going to have seen it before. We've never dabbled in this textbook before, and here we go. Ortho semester 1, learn all this new stuff. Well, I think that the way our program runs, the students have this resource from gross anatomy onwards, which means we are pre-exposing them to range of motion, MMT, and palpation. We are pre-exposing them to little things in ortho, just a trickle at a time, because it gets them excited. When they're looking at the anatomy, they begin to allude to, oh, I remember that special test. No wonder that special test is like that. Imagine how much more interesting gross anatomy is because of those clinical correlates. So many of these foundational classes are disconnected from the clinical classes. So again, we try to build the bridges forward and back throughout the apps, so there's connection between the content. So for example, in gross anatomy, one of my colleagues from Northeastern, Eric Fulmar, he said, hey, in our class, in our gross anatomy, we do a lot of palpation in the associated class in the same semester. Could we add in our palpation list? So I said, hey, that's a great idea. I think that's what we kind of do as well. And so we added a bunch of soft tissue palpations, bony palpations, their clinical correlates, why you might be interested in palpating these structures. And then they're kind of mixing and matching throughout gross anatomy. It's tied to the PhysioU app. Here's pec minor, and here is your pec minor palpation. So again, that kind of illustrates a little bit of the flexibility we have to augment the tools to continue to serve the needs of different programs.
When palpating pectoralis minor, going to have the patient in a supine position.
And you can see also that we have added the origin, insertion, innervation to kind of build that bridge between, the clinical palpation and then the gross anatomy content. Yes.
Hi, how are you?
Hi, Lisa.
No, I'm good. I'm watching a little bit of the webinar.
Oh, okay. I think she's on the phone real quick. So here I would say the other thing,
because I have to wait for a delivery of items.
Sorry about that, everybody. So the other thing that we do is we try to basically oops, sorry about that. I'm going to mute that. Okay. We try to connect some clinical presentations to the structures that they're studying that week in anatomy. So I'm going to go here. So our students get an automated email. There's a few programs that use this. We can help you. If you send us your anatomy syllabus, your students will get this automated email series.
Awesome.
And what happens?
There's a teacher for that.
What happens is that, actually, let me just make a quick request. For those of you who are able, if you're able to mute your device, let me see if I can do that real quick. There we go. Okay, there we go.
Yeah,
Sorry about that. So, yes. So you can see we have linked gross anatomy. They're in the knee joint. They get an email that says, hey, do you want to learn about the kinds of patients you're going to see in ortho? So here, what they'll do is they click on the different links and they get to watch a 1 or 2 minute video of a patient or someone simulating a patient that has knee osteoarthritis. So the students in anatomy are like, oh, that's so cool. Yeah, so I'm studying the knee joint or I'm studying the ACL and hear how these different patients present. So that's what happens on Monday. Then we kind of take that little blog post further. They're looking at different structures. And so we have chosen 2 or 3 pathologies that we think will pique the students' interest. And so what happens is they get another email on Wednesday that says, hey, do you want to learn about people with ligament sprains? Well, that ligament sprain is called knee pain with movement coordination impairments, knee stability and movement coordination impairments. So I'm trickling the guideline-based language in there. And then they get to learn a little bit more about how we would test it. So there's the common pain presentation. Here's some anatomy. And by the way, here's some special tests. So you can watch it if you want. If you recognize it, that's great because I've created a synapse in your mind. And when they go into the app, they're like, oh, this is part of a cluster of techniques that I'm going to learn. So they begin to get pre-exposed. Again, I just think of this as risk-free graded exposure.
Dr. Wong, this is James.
Mike, can you share your screen? Yeah.
Oh, sorry about that.
Yeah. And also, you're kind of addressing 2 comments there in the chat group, both from Paul. One is, and I think this is very helpful, Paul, the suggestion on it's kind of like some actual patients, that have, because students now it's real hard for them to get previous experience before PT school, see what a total hip or total knee patient or a stroke victim looks like. And your recommendation or suggestion is short videos on the actual patient, I think is very helpful.
Yeah.
For the physio guys to continue as they develop. This is a very ongoing development, like Dr. Wong said. There's no new additions. We're just going to keep improving it.
Right.
But then also, you mentioned there, this is movement impairment with blah, blah, blah. And Paul also identifies that there's some clinical instructors and clinicians in the student training period that don't use that pattern recognition model for their clinical practice. Any suggestions in terms of how to address that with the
apps? So,
yeah.
Paul, let me actually, could you clarify for me, are you talking about how we lay out these patterns early versus a clinical reasoning model that is developed on information gathering and then developing patterns out of that? Or are you talking about the movement system impairments and movement faults and the integration of those concepts into the standard orthopedic mindset? Could you clarify?
Yeah, it was more having to do, so when you were talking about kind of some of the stats that you,
that
when
we
you were
collected.
interviewing the students and things and how they like the apps, it just came to me that, sometimes our students, they learn the ICF model and this clinical pattern recognition, but then they go out into the clinic during their internships and faculty and practicing clinicians who may have been practicing for some time aren't ingrained in this thought process, or they're not ingrained in this clinical reasoning model. I'm just wondering how the student, do you ever teach the student how to teach the clinician some of this content?
Yeah, absolutely. So I think for our students' success, they must be flexible. So we can't teach from a high castle and claim that this is the way and everyone else needs to catch up. So we purposely, I remember when Marshall and I were first building these apps, when you look at these ICF categories, low back pain with mobility deficits, back pain with related leg pain, or back pain with movement coordination impairments, no one could understand it. And if that was the only language that the students would learn from, though it is a very powerful language, we would just create another big chasm. So we purposely added in the common pathologic type term linked to the ICF category to make sure that they were flexible enough to be able to talk with a clinician about, oh, lumbar sprain and strains.
Okay.
Oh, that's a movement coordination impairment. Yeah, people aren't able to stay in neutral well enough that they're stressing structures. So whenever we teach it with that in mind, that they're heading out into a clinical environment that may not use this language or have ever heard of it. But I do think the underlying rehab concept of how we manage mobility deficits or muscle power deficits, the underlying concepts are consistent enough between a clinician who says, oh, that's a tendinopathy, I'm going to do eccentrics or some type of loading to the tendon after I rest it, and a student who says, oh, that's a muscle power deficit. I remember Dr. Wong saying that we use the EDU rep model when we work with tendinopathies. I think it is imperative that us as instructors teach them to survive in the world with that type of flexibility. So I go back and forth. I would say, though, that the ICF language is what I go through on the first day of class, and I tell them stories about the rehab strategy and the examination strategy that's consistent for mobility deficits throughout the body. Like, I assess range of motion, passive, active, and accessory mobility for all mobility deficits, whether it's a stiff elbow, a stiff shoulder, a stiff knee, or a stiff back. And they know that I expect them to apply some type of manual therapy that improves that mobility and some therapeutic exercise that stretches and improves that mobility. So those type of theories, I think, are general enough and flexible enough that it creates context for them to learn the details and apply the detailed techniques into this context. And yet it's also flexible enough that a clinician could say, oh, yeah, you can call it mobility deficits. I just call it OA. I just call it degenerative joint disease. But you're on track. You're assessing the mobility, you're treating the mobility, and you're gaining range with exercise. I'm okay with whatever language you're using. And by the way, what's that app? Oh, that's exactly how I think. So I see this really, hopefully, as a way to build a bridge. I hope that helps, Paul.
It does, yeah. And that's what I was wondering is, yeah, that does help. That does help.
Absolutely. Feel free. And so that's the same thing that I'm doing here with these little like intro emails. The students, I go into gross anatomy and I tell them, guys, this is a no risk, no punishment, enjoyment of learning type of little email blog. So you go and explore a little, because I think it'll get you excited about the stuff you're learning in anatomy. So they're going to watch a patient that looks like he has knee OA, or someone with an unstable knee with an ACL tear, or someone with IT band syndrome. So they're going to see what these patients are like, and they're like, oh, I can't wait to get to ortho. And that's cool that we're looking at these structures in anatomy. And then in this other component here, they get to go in a slightly deeper dive and look at some special tests, look at some treatment strategies. And I'm going to build on this 2 semesters later when they get to ortho. But until then, I'm just going to trickle this into their mind and invite them into PhysioU. That was the secret reason why I did this. So this is automated. The instructors don't do a thing. The students just read it, open it, and enjoy the learning. As mentioned earlier in the cardiopulmonary class, Susan will we basically created quick access buttons. So there's interventions, there's physical exam. So all the things that the students are going to learn in class, including my class in ortho, are all in these little quick access panels. So she'll just have the students pull up, open physical exam in your Cardiopulm app. These are the techniques that we're going to do this week. It's linked in your lab handout. Go ahead and watch them before class. I'm going to talk about them and how to use them when we get to class together. And so you can see all those patterns there. you know, as part of the acute care setting, and actually this is really useful for ortho as well, for all of our content, we built an Assistive Devices app because our instructors said, you know what, it's really painful for the students to read about a modified 3-point gait or to read about, you know, fitting crutches. If they just watch the video once, they watch the different gait patterns ahead of time, when we come to class, we try them together, class goes so much faster. So you can see that not only have we filmed these for student learning, but we filmed them purposely because you could email. So we film right leg and left leg. So any gait pattern, any assistive device, any going up and down stairs with whatever device, we've filmed it for for both lower extremity, upper, right and left, and you can just email that to your patient as needed. So the students use it in class and they use it in clinic. For neuro, Mary, we talked a little bit about you having to teach neuro. Our neuro instructor said our students have a really hard time reading about NeuroExam techniques. Could we film them all? So one of the clinical specialists, she was the director of the Casa Colina Neuro Residency. We brought her in and we filmed everything related to neuro, the exam part. We actually we're about to release the intervention side soon with Sarah Kraft out of Medical University of South Carolina. So, as well as a PNF app from Kaiser Vallejo. But you can see here, for example, our instructors will say, guys, this week we are going to learn balance stuff. So you don't need to learn them all, but I want you to be exposed. So here's the NeuroExam app. Here are the 10 balance tests that we're going to do in class. We're going to do functional reach, 5 times sit to stand, the Berg balance test. Here, all of those tests are there. And you can see that they can watch the video, they can learn the setup, they can look at the normative values for fall risk. All of this is linked to their references. That's how you would use it in a neuro class. So I think that can make your life a lot easier in neuro. Does that help, Mary? A little bit? And a lot of the interventions for PNF, a lot of these different techniques, they will have some form of it in the Neuro Rehab app that we are basically getting ready for release. So let me take you into, actually, I think of these apps as allowing the students to learn beyond the boundaries of the curriculum. So you're not stuck only waiting until your class comes before they can access different resources, like the ortho content related to anatomy. I don't think they can handle a lot, but I think they can handle a little, and that really sparks their interest. Allowing students to get the 50,000 foot view. So as I've mentioned before, in the ortho apps, I essentially run them through a pattern. So in the shoulder joint, I will make sure that today, on Tuesday, when I have lecture with you, I'm going to talk you through the 3 most common patterns of shoulder problems. So here's shoulder. We can either play the pattern out. So I can say, hey guys, so this person has pain at the tip of his shoulder. It's sharp and pinching. What are some hypotheses you might have? I just do that in class. They don't know anything about the shoulder yet. We just have fun. I try to figure out what they know. I try to validate what they know and kind of nudge them in the direction that I'm hoping to take them. So they could go, oh, that might be an AC joint sprain or subacromial pain syndrome. Great. Yeah, that would be considered like a rotator cuff tendinopathy. We consider that a muscle power deficit. So again, that language is kind of interspersed. And then we watch this patient showing an arc of pain, showing some faulty movement, excessive internal rotation, showing that he has pretty good range of motion and pinching pain towards the end range and in the arc. And then I'll just ask them, hey, if we're talking about shoulder tendon problems, muscle power problems, potentially shoulder impingement, what kind of test have you seen in the clinic that you think would be relevant? You'd be surprised. Half of them say the right thing. They just don't exactly know what it is and why it's useful. And so I get to validate the things that they're saying by going, yes, that's a group of impingement tests. This is a cluster of impingement tests you're going to find in any impingement study. Do you see how when we can pinch it, and here's your sensitivity specificity data, or I want to test the tendon, so I'm going to do some manual resistive test. All of that, you can see this is even before lab. I'm just setting the stage for them to be able to receive information in a contextually rich environment. So we'll play this all the way through. We'll talk about differential diagnosis. So there's differential diagnosis here. We'll talk about common associated impairments like thoracic mobility, upper quarter muscle length tests that might be relevant. So imagine how much you can do at this 50,000 foot level that gives them a framework in which to live in. So that's all I would say about this. Our students watch these little clinical reasoning videos also as another way to trickle understanding into their mind. And we go all the way from therapeutic exercises to modalities. I talk about modalities all the time because I used to teach that class, and I hated it when the students are like, why are you teaching this stuff? No one uses this stuff. And I would say, no, that's not true. In the frozen shoulder guidelines, under the interventions, there is evidence to support the use of some of these things that you learned in your modalities class. Here's the grade of evidence. That's powerful because you're validating the things that other instructors are teaching and you're making it relevant again. So I think that's one of the cool things about the guidelines as well, is it's not just all manual therapy and therapeutic exercises. It tries to cover a pretty broad spectrum of reasonable interventions. Okay, so let me take you towards the finish to show you a glimpse of some of the things we're releasing. Many of you have seen the Gait app. I think the Gait app is really an amazingly well done app. Chris Sabelski, myself, and the author of the Gait app will be releasing a functional movement app based on the same premise of Gait, meaning there will be phases, there will be critical events of forward bending, return from bending, sit to stand. We're going to try to make very simple how to visually analyze movement. So that's, I hope you guys will play with the Gait app. You'll see that it fits in very well with how you teach Gait. It's based on the Rancho and Perry book. All the numbers are normalized to that. This is a visual movement analysis app created. Actually, a lot of this content is from Edie Kendall at Plymouth, and also a computer program professor at University of Idaho. And so what we've done is we have created the Edinburgh Visual Gait Score. You can choose different children with different types of pathologies. And then you can go through and start scoring and doing your visual movement analysis. So the students can practice using a quantifiable gait score to do movement analysis, and they can compare what they found later with each other and with a key. So I think this is kind of one of the explorations that we've tried. How do we make movement analysis a little bit more systematic? How do we protect the privacy of patients? And how do we utilize a gamified environment to engage the student, right? So this is one of the things that we're on the final stages of getting ready to release. So I think it's kind of cool. Here is the problem that I'm trying to solve, which is when I'm done teaching shoulder joint for the week, like Steve, you're going to be teaching ankle and foot. So ankle and foot's littered with all kinds of little biomechanical tests and all kinds of stuff. How do I pull it all together so that on the output of that week, the students will be like, oh, I know how to assess and manage plantar fasciitis or an ankle sprain or great hallux rigidus. So I remember when I was young, I think many of you probably remember these Choose Your Own Adventure books. So this year I spent a lot of time at conferences that had nothing to do with PT, but had everything to do with learning and technology. And so what we've started to build are clinical reasoning games, choose your own adventure games, based around all the main common conditions you find in the PhysioU apps. So here's a tennis elbow person. And as you play through the game, you're going to see information that you have collected, and you're going to be asked to make some decisions about, hey, is this, when you see this outcome measure score, are they highly disabled? Are they low disability, high disability? So you ask them to make decisions. We give them recaps of information that they gathered, and then we force them to make simple decisions. These are not hard games. I see this as a stepping stone, just pulling things together. So they will make decisions like, oh, this is a painful tennis elbow. Their range of motion is good. Their strength is low and painful. So I need to make some decisions. Am I going to do functional movement training? Am I going to do range of motion, restoration, some mobilizations? Or am I going to do some type of eccentric exercise or some modality? Is there pain and inflammation? If they make the right choice, they get a little endorphin release. The person's happy, they're getting better, and you're doing a good job. If they make a wrong choice, I want to be able to punish them a little and nudge them back on course. So the patient says, nope, you know what, their range of motion is normal. So doing mobilizations, improving mobility is not indicated, but you can still help. So click to pick a new treatment. So you can see what we're trying to solve here is synthesis, interaction, and making decisions with the stuff we just dumped on them that week. So I envision my students playing through the Sims on the weekend after I just taught them everything related to foot and ankle, related to elbow, related to shoulder. The other cool thing that we built in here is at the tail end of every case is week 2, the patient returns. What would you like to ask about? And when you finish asking about their pain, their home exercise program, their region of pain, there is some decision making. How irritable are they? How would you like to progress or regress their treatment? What is the most important impairment to continue to treat? So I think this will begin to solve some of the problems that we just don't have time to solve. We know it's the problem, we just don't have time to solve it. Any comments or questions about that? About these Sims? Please be on the lookout. I'm going to be doing a webinar. Actually, it's really just going to be a roundtable of instructors who are interested in speaking into this building process. I will share with you the different clinical reasoning moments where we ask students to make decisions. And I'll share with you kind of this bigger picture of what we're trying to build. We have about 40 of these right now that we are actually going through. You can see they take forever to build. But once we build them, all of us can benefit from it. Just imagine how excited a student will be to get through your week of foot and ankle, Steve, and then go into the weekend to play the Sims. Can you imagine what that would do for the integration? Something that also James and I have been thinking about. So my students just finished taking their law board exam. They complained endlessly to me about how horrible it was to study for it and how they really don't understand half the things that they studied. So James, who is the past president of the California chapter and also teaches a lot of this laws and regs type of stuff, we decided there's got to be a better way to do this. And so what I would say is we have built, our first model was of course for California, but we are now transitioning these courses to meet the laws and regs for every state. Students will learn the laws and regs that every professor needs to teach in their classroom by interacting in a context-rich environment. So these are the different modules. So every module is built around cases. And the student will get to play as the PTA student, as the student PT, as the PT aide, or the PTA, and they will learn and make decisions in which we will apply the laws and regs. So if I were to give you a glimpse of that, you can see these are all of our modules that we've completed. Let me show you real quick. And I know we're running short on time. We're actually pretty much done. Here is the laws and regs course. So I am proposing that your law and reg course can be interactive every week. The students can play this to learn the laws and regs, and will use this again as they're prepping for their law and reg jurisprudence exam, if your state has it. Nevertheless, I think we will build better clinicians who understand the laws and regulations. So if you go into the course, you'll see that here are the different people. Here's the scenario. Jim is a physical therapist. He owns 3 practices, and he's late. His flight's been delayed. So here are the different people that you can play. There's Tyler, the PTLA, Gina, the PTA, and Ricky, right? Ricky, the PTA'd. So from there will be scenarios. And as the scenarios play out, different questions that we think are critical for playing out the laws and regulations will come up. And the student will have to think, is that the right thing to do? They will learn either way. So is it lawful for Tyler, the PTLA, to follow the director's instructions and continue to treat the patients even when Jim is still on the plane? So we'll say, no, I'm going to not do that. Let's see what happens. He says, that's right. This is what the law says. You need to be under direct and immediate supervision. And by the way, here is the code that tells you that. So imagine learning all of laws and regs this way, through context, through scenarios that they're actually going to face in the clinic, and how much better and how much deeper they will be able to learn this. And in fact, James, as we were talking, there are 2 locks. In many states, there are 2 locks to the door to clinical practice. One is, as you mentioned, the clinical board exam, NPTE, and the other is the jurisprudence exam. And I think we can do a better job in preparing our students to successfully navigate being an ethical and legal clinician, as well as to get through their jurisprudence exam.
If I can chime in,
yeah, go for it.
The challenge for me is the poor students who are burdened with debt. They're trying to get to work as soon as they can, but you got to have both of those locks undone. And in California, 72% passing rate for the physical therapists in 17-18, and 76 passing rate for the jurisprudence exam, the California law exam. So about a quarter of the kids still cannot work. I don't care if you got 100% on the NPTE, you are not getting a license practice. And every week and every month they're delayed. They're losing money they could be earning to pay back their student loan and stuff. And so that's what it is. At the national level, if you combine it all, it's about 80% 80% passing rate. So again, 1 in 5 at the national level are not passing. It gets even worse if they come from non-accredited programs, which basically be the foreign trained students and those who in California are still an opportunity to challenge our physical therapist assistant exam to do that. So, and the neat thing is that there's actually blueprints that the Federation State Board has. About 9 states have kicked the responsibility of managing the Laws and Regs exam to the Federation. There's actually a blueprint. So the neat thing too is going over this app. It's very efficient. There's no extra laws they have to learn. That if you look at laws, they go forever. But these are the ones that are going to be tested in your Laws and Regs exam. And so we're pretty efficient with what the student has to learn. And then gamifying it and making it kind of fun learning also helps it stick, for the student. So I think that's an area that, it's like, oh, I got to study my Laws and Regs now, where everyone really is concentrating on the NPTE clinical practice side of things. But if you don't have that deadbolt unbolted, the handle can turn all you want, but it ain't going to open the door. So
right. Yeah.
We thought that was a need for students.
Yeah. Nice work, James. So I think in closing, all I would say, and then we would just open up for discussion. I know as people need to leave, we are working, there are many universities using it. We are also, a lot of universities are trying it out. Know that you each will have full faculty access for you to utilize in your classroom. We hope that it will make your life easier and make the learning for your students better. I'm always happy to jump on a call, whether it's with you or I do this a lot with, I kind of zoom into a faculty meeting and just take questions or share about key content areas that people want to learn about. So I can always do that. You can see the evolution of the apps. So this year at CSM, we released developmental milestones. So now you get to watch a baby develop month by month and use that as a resource for talking about child development. We also released lines and tubes, so that will help in the acute care setting. So all the common lines and tubes, the clinical considerations, what they're for, just a quick access guide for your students to make the entry into the acute care setting a little less daunting. So we have a therapeutic exercise app coming out. We have a PNF coming out. We have a lot of cool new things coming out, but I think the Sims are something that I'm very excited about. This Jurisprudence law exam prep course / I see it as being utilized by our students within the Law and Regs class as well. So they learn it there and they learn it again when they go to prep for the law exam. So the cost to students, less than a MOCA a month, so $54 a year they pay annually. If they pay for 4 years, they get it for the price of 3. This is essentially the price of one textbook, if you think about it. And all of the faculty have full access. So I would encourage you to play with it. Feel free to ask questions if you see something that you feel really should be in there. We're always looking to make the apps better. And the way that the students get it is really simple. You just tell them, hey, when you go to PhysioU.com, there's a student tab. And in the student tab, if you use your .edu email, you will get the option to basically buy it for that discounted price. I mean, the reality of it is we have tried very hard to maintain a very reasonable price point. It is way less expensive than what it takes for programmers and filming and to pay patients as we create this. So we very much appreciate the faculty who are encouraging the students to utilize this. I hope it, most importantly, is helpful in their learning and makes your teaching easier as well. So in closing, I'd just like to say, are there any comments or questions or ideas of things that you feel really would be nice to have? I'm just going to open it up for these last few minutes.
Personally, Mike, I've followed you since you did this way back when, and it's amazing how this has grown. And, other than using it in the clinic personally, I've had a chance to use it in the classroom, but I can see this being, a much stronger tool for there. I'm looking forward to implementing it. One of the other courses I'm responsible for is a professionalism course, and I could see a lot of this stuff being very helpful for that as well. So I'm looking forward to using it. One of the questions I had was that, the old app was, you had it right on your phone, everything was contained. This is all off the website.
Right.
So what's the best way for people to link this to their application device? Because it's easy off the website, but do you have to go in, create your own icon, go about it that way, or do you have something on your website you can just download and get a connection to?
Yeah. So usually what I do is on my laptop, I just go to PhysioU.com, the app, and I bookmark it. So that's easy. Right. But you're talking about on your mobile devices. So on your mobile devices, the way to do it is there's a link here at the bottom that is frequently asked questions. And in the frequently asked questions, can I use the web app version on my smartphone or tablet? There are step-by-step instructions.
Yeah.
So when you log in on your browser on your phone, once you are logged in, it's actually pretty simple. You are able to now bookmark or add to home screen.
Yeah, that's why I figured that's where we were going with it.
Yeah.
But not everybody knows that, and now I can see now that if I said to someone, go ahead on the site, you can just link to it this way. That's easy to do. So,
yeah.
Thanks.
Yeah. Exactly. Thank you for bringing that up, Steve.
Yep.
Hey, Mike, there was a question about having the institution pay instead of individual students. I don't know if you can address that.
Yeah. So we have a lot of institutions, particularly the PT assistant programs, where the program purchases 36 so-called subscriptions for their students. So the institution essentially sends us an email list, or we work with the bookstore, and the institution will just send us a check. We want our students to have it for all 3 years of the PTA program plus the 1 year, so 2 years plus 1 in the clinic. and they basically send us a check. We provide access to all of their students, or we work with their bookstore. So there's various ways to do it, and that allows for the student now to either have that embedded within the cost, kind of the course cost, or it can be part of their financial aid because it comes through the bookstore instead of going through privately through PhysioU. So if you have that question, feel free to reach out to myself, Mike@PhysioU.com, and I can put you in touch with our chief operations person who works with all the bookstores, and she can set it up very easily. Any other comments or questions?
I'd like to be, keep me advised as to when you have these webinars, because I think they're helpful. To you're using this all the time, using it in the classroom. I picked up a lot on what you were just, matter of fact, talking about, the way you're using it in the clinic. So I think it's helpful to get some, you're sort of mentoring in different ways to use it. And I think that's really a good thing to do.
I think what I'll do is we'll have a series this year where it will talk about cardiopulm, ortho, neuro, some of the key classes, probably peds as well, where our instructors have been learning how to use it with the students, and we can share that, and then everybody can just share ideas. So I think you can look out for that. I have that in the works.